As Joanne mentioned, we're an alliance of about 90% of the nation's academic medical centers, and UHC is delighted to have the opportunity to partner with the AAMC on the Best Practices for Better Care initiative. Helping academic medical centers improve performance is really at the heart of everything that UHC has historically done. We have extensive comparative data and a long history of clinical and operational performance improvement. We actually have conducted over 60 benchmarking and improvement projects in which we identify top performers, explore what they're doing successfully, and then develop practical tools and resources that others can use and implement in their organizations. We have facilities to allow for transparent data sharing and the ability to track performance over time. This mechanism to identify top performers has been utilized and tried and tested. We also have the opportunity to sometimes evaluate implementation and penetration of evidence-based practices. And most importantly, we have joined organizations together through collaboratives, the opportunity for peers to work together, not only to implement best practices, but also to explore the ideas, approaches, lessons learned that will successfully achieve performance excellence. UHC has some proven experience in identifying and sharing insights to make change and sustain improvement. Actually, one example of this is our quality and accountability study. This study was conducted in 2005, in which we identified organizations who were performing at a high level when we looked at patient-based outcomes metrics. We took those organizations and we studied them extensively to identify the features and characteristics of those organizations, and then we shared that information broadly. Actually, that study was published in Academic Medicine in 2007, and that work continues today. Our experience in 3 of the initiatives that Joanne mentioned will help jumpstart the work to ultimately ensure that there's safer surgery as a result of implementation of surgical checklists, hopefully reduce infections related to catheter lines using proven protocols, and reduce hospital readmissions for high-risk patients. We know that starting with the literature and the evidence-based practice to deliver positive patient outcomes is a critical first step. But implementing any new process is extremely challenging, and it requires a dedicated effort at all levels of the organization, from the executive level all the way to the bedside. Best practices for better care will equip each participant with the practical and relevant information needed to achieve these positive patient outcomes. And throughout the initiative, this information will be publicly accessible through our website. We look forward to helping organizations that are committed to best practices for better care connect the processes and outcomes and make sustained and measurable improvement. I want to thank Joanne for the opportunity to be a partner on this initiative. UHC is very honored to be participating. And I'm going to turn it over to Peter Pronovost, who will tell us more.
Thank you.